Now I'm going to give the summary or pre-assessment for the subjective data for our musculoskeletal assessment. For the present health concerns, there is no reported weight gain, no reported problem in chewing, no apparent problem with the muscles, the skeleton, or the bones, or the joints. No complaints within those regions or fields. For the patient's personal history, he notes no injuries, especially to the muscles, joints, or bones. There are no PT sessions or treatments to alleviate pain or discomfort with any pain, since the patient is not experiencing any pain at all. There's no history of surgery. The patient has unrecalled vaccination or immunization with tetanus and polio. The patient had never been diagnosed with diabetes mellitus, sickle cell anemia, and systemic lupus erythematosus. The patient is a male client, therefore there is no menstrual cycle and menopausal assessment or inquiries regarding this portion. So the patient is not taking any estrogen therapy or hormone therapy as well. So let's go on with the family history. For the family history, there is no history of rheumatoid arthritis, osteoarthritis, and osteoporosis. Moving on to the lifestyle and health practices. Activities to promote muscle and bone health. He does stretching every day prior to his duty. He admits that he lacks the exercise because of the duty in the hospital, but he makes up for it by using the stairs instead of using the elevator. So the patient's diet is controlled, but on a regular diet as tolerated. So there is no weight reduction practices for the patient. So for medications that the patient is taking, he's taking vitamins with supplements of calcium since it's needed for bone development or bone strength. The patient is a non-alcoholic, non-smoker, and he does not drink coffee. Therefore, there is little to no consumption of caffeine in his or her beverages. So, the typical diet for my patient is rice, fish, vegetable, and occasional meat of chicken and beef in origin. For the daily consumption of calcium, he claims that he drinks at least 1 to 2 glass of either soy-based milk products or dairy milk products. Okay, so continuation for the lifestyle evaluation. So what is his activities during the day? He walks a lot since he's a medical doctor. He walks from the 4th floor to the emergency room using stairs. Exposure to the sunlight, he claims at least 10 to 15 minutes a day. When going to work, he is exposed to the sun by that long. And his routine is more of stretching exercises and use of stairs. As I stated earlier, the occupation of my client is a medical doctor. He claims there is no difficulty in performing normal activities like bathing, dressing, transferring, eating, and grooming. Okay, so there is no need to use of assistive devices in performing ADLs. He's able to do it independently. So the client does not have any complaints with the musculoskeletal activities. There's nothing interfering. Therefore, the client has no view of before and after with the problem. The client does not have any effect on stress with the musculoskeletal problem, and he has no perception alterations regarding musculoskeletal problem. Okay, so now we're going to do the objective assessment or objective gathering of data. So for our musculoskeletal system, what we're going to do first is we're going to gather the equipments. So for our equipment, we would be needing a tape measure if necessary. And then for an optional use, we need a skin marker and goniometer, which is not available right now. So we'd be just working with the tape measure. So sir, good morning or good day. I am Val, your nurse for today. We're going to assess your musculoskeletal system that involves your muscles and usually the bones and joints. Okay, so this one is important so that it would be added for your health record as baseline for your later on health examinations. Okay, sir. So the patient is already on the gown. I let him change earlier, but if your patient is not yet on the gown, allow him or her to wear a gown. Sir, don't worry. Your privacy, safety, and confidentiality of the data would be kept within the hospital premises. So rest assured that there would be no privacy breaches upon doing this exercise or assessment. Okay, so we would be first, I would be first observing your gait and posture. Kindly stand, sir. Okay. Feet. Okay. If you're dealing with an elderly patient, try to support or try to check the stability of the patient because your patient might fall down because we observe safety. That's why we do positioning like this. Okay. Try to observe the gait and posture. Okay, sir, what I want you to do next is try walking in a normal pace, starting here, going there, and going back. Okay, your normal walk. Okay, thank you very much. Okay, so please sit down, sir. Okay, so on assessing for the gait and posture, the patient is standing erect. It's comfortable for his age. There is no extra movement or swaying, extreme swaying. There's a little bit of sway, but it's not that noticeable. And the base of the foot is already there. That the heels and the toes are supporting for the even distribution of weight for the patient. The stride or the movement of the arm swing are fluid and opposite of the foot, which is forward. So when the patient is walking, it's done like that. Okay, so we're done with the gait in posture. Now we're going to do our temporomandibular joint. So sir, kindly remove your mask first. Okay, sir, what I want you to do, sir, is follow my commands while doing this exercise, sir. So please open your close, open, close, and then sir, I'll just be observing, sir. Kindly open your mouth, close, and then try protruding it, putting out and returning. Very good. Try moving it from side to side. Okay, thank you very much. Is there any pain while doing that exercises? Now I want you to do, sir, is move your jaw left to right, but with resistance. I'd be putting pressure or resistance here and try to move your your chin from left to right. Okay, thank you very much. So, upon findings for our assessment for our musculoskeletal for temporomandibular joint, the patient is upon checking for your temporomandibular joint, there is a felt snap and click when the jaws is opening and closing. The jaws moves laterally from side to side at least 1 to 2 cm. The jaw easily protrudes or the chin pulls forward and backward easily, and then there is full range of motion against resistance when the jaws is given resistance and palpated, and as stated by the patient, there is no pain or spasm. We go to the next joint, which is our sternoclavicular joint. So sir, I'm going to inspect and palpate. I am going to inspect first and then later palpate your sternoclavicular joint. Okay, for this one, try to lower your gown. Okay, so sternoclavicular. Okay, sir, I'll just palpate. Okay, is there any pain? Okay, thank you very much. Okay, so upon assessment for our sternoclavicular node, right, so sternoclavicular joint, what I mean, there is no visible overgrowth of bony prominence there. There's no redness, there's no tenderness, and there's no pain upon palpation. Okay, so we'll be moving to the next, which is the cervical, thoracic, lumbar spine. So, sir, now I'm going to inspect and palpate for your cervical, thoracic, and lumbar spine. Okay, so while sitting down, I would like you to observe your neck, sir. Okay. Let me check here, the other side. Okay, stand up straight. Sorry, sit up straight. I'll just be assessing. Okay. Is there any pain upon palpation? Tell me, sir, if you're feeling sudden pain. Okay. 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 Upon initial palpation and inspection, the cervical and lumbar spines are concave. The thoracic spine or the thoracic area is convex. And upon looking or inspecting, the spine is straight when I observed it from behind. So upon palpation, there is non-tender spinous process as well as what do you call this? Paravertebral muscles. There's no muscle spasm. Upon movement, it's moving along but not that much movement. Okay, so sir, now I'm going to test for your range of motion of your cervical spine. Now I want you to do the commands that I would tell you. Kindly remove your mask for this exercise, sir. Okay, so sir, I want you to do chin to chest. Okay, chin to chest. And now look up to the ceiling. Okay, so hyperextended. Now I want you to relax again your neck without moving your shoulders, your ears going to your shoulder. Okay, try to relax not to move your shoulder. Okay, very good. Just don't force it, sir, up until what angle that you could do. Okay, now I want you, sir, to do is your face goes to your shoulder, looks over your shoulder. Okay, and then other side. Again. Thank you very much. Now, sir, okay, you could wear your mask. What I want you to do, sir, is the same exercises, but now I'm going to put on resistance, okay? So now, sir, what I want you to do is, for the first is chin to chest. Try. Okay. Try doing it. Okay, thank you very much. Now, sir, looking at the ceiling. Okay, very good. Now, sir, what I want you to do is the ear to shoulder. First towards your left. Okay. Now towards your right. Okay. And the last one would be movement of your head. Please move to the right first and to the left. Okay. So, the findings for assessment of our cervical area or ROM. So, first, flexion of the cervical spine is 45 degrees as the book says. But the extension is 45 degrees. Normally, the client can bend at least 40 degrees from side to side. And for the range of motion, the patient is able to look left or right with smooth transitions. No pain, sir, right, when moving. And upon resistance, the patient is 5/5 strength because he can move against the resistance. Okay, so next one, we would be assessing for your lumbar spine, sir, the lumbar area. I will be checking it. Now I want you to stand, sir. Okay, sir. What I want you to do, sir, is face this side. Okay, so the other camera can see. There you go. Now, sir, I want you to bend over and try touching your toes. Okay, so try holding that position, sir. Okay, very good. Is it painful? Could you hold that position? Okay, I'll be observing your back, your scapula. Okay, sir, you could now raise. Were there difficulty when maintaining that position? Okay. Now, sir, I would ask you again, sir, to sit down. Okay, so upon checking or assessing, inspecting and palpating or observing the lumbar spine, there is smooth movement on the concavity. When the patient bends down, you see the curvature of the spine follows and it maintains natural alignment upon observation. And the lateral now, sir, I'll be checking your lateral movement, sir. Please stand again. And what I want you to do, sir, is twist a little bit towards the right. Okay, sir, I'll just be observing it from the back. Okay, and then towards the left, twist a little bit. Okay. Now, sir, what I want you to do, sir, is turn from side to side like so. To the other side. Okay. I'll be checking it, sir. Again, sir, try. Again. Okay. Now I want you to do it with resistance. Side. Okay, another side. Okay, now, sir, try twisting. I'll put resistance. Okay, another twist. Thank you very much. Just be putting on your gown. Sit down, sir. Thank you very much. Okay, so upon testing the ROM and the resistance, the patient has good range of motion, even with resistance, therefore giving him a score of strength 5/5. Now, sir, what I'm going to do is I would ask you to lay down and I would do the straight leg test. Okay, class, let me emphasize, straight leg test is done if the patient complains of lower back pain and hip pain while doing the bending over earlier. So for demonstration purposes, I would be demonstrating it to you. Sir, kindly lay down. Okay, careful, sir. There you go. Okay, sir. Now I'm going to, for example, the patient has lower back pain. This is just a reenactment. Okay, sir. What I'm going to do is I'm going to do your straight leg test. I would be flexing. I would be lifting your leg, and then try to flex your hip, and tell me whether you feel the pain. Okay. Okay. So for example, class, this is the angle that the patient is experiencing pain. What you're going to do is you're going to dorsiflex the foot and document the angle in which the patient is able to feel the pain. Okay, and put it down. Try to relax. If the patient complains of pain, don't try to aggravate or move the affected leg kasi it would cause the patient to be uncooperative or change the vital signs or feel uncomfortable during the examination. So normally, this is not found. Lower back pain is not found. But for if ever there's lower back pain, when you do that, it would be positive, the straight leg test. Okay? And if ever there is pain on the lower back and you suspect for what they call this, one leg longer than the other, next we're going to use our tape measure. So what we're going to do is test for the the true leg length. So how would we measure it? From our pelvic area, we would be spreading. Let me just demonstrate. Okay, so I'd be assessing the pelvic area or the pelvic region. We've already discussed this, but for demonstration purposes, I would be starting it here on the pelvic area or the iliac. And then I'd be measuring the length towards the ankle on the inner side. Okay, so this one is 82 centimeters. For example, the patient's leg is unequal. We will be measuring it. Okay, then I will be measuring it on the other side. Same as well. From the outer part of your pelvic area or the iliac crest towards the inner part of your leg. So for this one, for example, there is unequal leg length. So I've noted 82 centimeters on the other side. This one is 84. Therefore, I'll be remembering that and documenting it in our chart. But that is just for the example for irregular foot. Okay? So the next test that we're going to do is our shoulders, arms, and elbows. Okay? So sorry sir for disturbing you, but I need you to sit down again, sir. Assist your patient if he has difficulty. Okay? So this one, sir, I just... Okay? You could do it sitting down. Okay? So for example, for this test, you could ask your patient sitting down, especially if he or she is an elderly. But for able patients, you would like him or her to stand up so that you could see the full range of motion. But for this test, I'll be moving the bed backwards. Okay? So sir, now I'm going to inspect and palpate our shoulders, elbow, and joint, and then later on I will be asking you to do some movements or exercises. Okay? So let me just assess first your clavicle. I'll just inspect it, but I've already inspected it in the sternoclavicular area. I'll just be doing palpation. Is there any pain? Okay, so I'll just be going down, sir. Okay, so if ever you're doing this checklist, I encourage you to pre-assess your patient because it involves exposing and removing of the shirt so that you could assess it further. So I've already assessed this one, but for demonstration purposes, I'm just trying to recreate what I did. Okay, so from down, sir, any pain here in the elbow part? Okay. Here in the bones. Okay. And here in the scapular area. Same so with this one. I've already palpated the clavicle. I'll work my way down towards the muscles. Any pain, sir? Here in the elbows? No. When I move it like so? No. Okay. Here, sir, no pain. And scapula. Okay. So basically, I've done the anterior and the anterior and posterior assessment. So the findings, upon assessment, the shoulders are symmetrical. There's no redness, swelling, tenderness, pain, heat, or deformity upon assessment, especially the clavicular area. And the scapular area are symmetric and equal in position. Okay? The client reports no tenderness and pain upon doing the palpation. Okay. Now, sir, I'm encouraging you to do what I say, sir. This one is to test your shoulder movement, your arm movement, and your elbow movement. Okay, sir? For the first step, I would like you, sir, to put your hands on the side. Okay? Just relax. And then the second step would be folding your arms towards your forehead, what I mean. Okay? And then pointing your fingers both together with extending elbows. Extending your hands forward, up, and down. And then up towards your head, hands together, then towards the back like doing a Naruto run, and then to the center, midline. And then what I want you to do is circle it up, circle it down, do a spin, hand spin, like doing a swimming stroke, reverse, okay, and then up, back of your head, and then back of your hips, and then back to the side. Okay, so what exercise that I did, we've assessed the full range of motion for our shoulders, arms, and elbows as well. So the findings are, so the arms are able to flex, extend, hyperextend, like so, and do circumduction without any... Did you experience any pain while doing the exercises? Without any pain of movement. The elbows are able to flex and extend at the same time, and flexion of the arms are evident during the test. So there's no pain upon doing that. There's smooth transitions on doing the exercises, therefore giving the range of motion a good run. The elbows are also, as what I did earlier, the elbows are able to do supination and pronation upon command. And now, sir, Now, I just want you to try to flex your elbow. I'm putting on resistance. Okay, try to extend. Okay, the other hand, try to flex, try to extend. Okay, so upon putting resistance, there's full ROM. I could grade it with a strength of 5/5 as well. Now, sir, I'm going to inspect your wrist. Okay, so let me just check first and inspect and palpate. Thank you very much. Okay, is there any pain? Okay, so upon inspection and palpation of the wrist, they are symmetric in anatomical proportions. There's no redness, there's no swelling, there's no nodules as well. Okay, now sir, I'm going to do the squeeze test. I'll be starting from your fingers. Try to lower it, sir. Relax first your one hand. Is there any pain? Okay, the other hand, starting with your fingers. Is there any pain? Okay, so upon doing the squeeze test, the client tolerates the squeeze without extreme pain. And now I'm going to palpate for your anatomic snap box. So, class, for the anatomical snap box, you try to hyperextend the patient's thumb, and then you'll see a depression here in the thumb area. So, sir, try to hyperextend your thumb. Okay, so the anatomical snap box is present on both of the hands of the patient. Okay, so there's no tenderness upon palpation of the anatomical snap box. Okay, next one would be, we would be testing for carpal tunnel syndrome. So, this one, sir, I would like you to, do the wrist. This one is your wrist. Try flexing your wrist like so. Okay, try extending it upward. Okay, try reaching it out as far as you can. Okay, very good. So, upon the downward, upward, and movement of the wrist, there is no, what they call this? There's no pain, sir. There is no pain as claimed by the patient. And upon straightening of the hand, the wrist is able to move freely. Okay, sir, try circling your wrist on the other side. Okay, so upon movement or ROM, there's no pain and it moves freely. Okay, so now, let's check further. I'm going to do, sir, the Phalen's test. Like what you've done earlier. The back of your hands together and the elbows extended. Try lowering your elbows or shoulders, sir. Okay, so upon the Phalen's test, observe for any vibration or any jerky movement on the fingers. Therefore, there is no vibration or jerky movements on the fingers. No tingling sensation, sir. No pain. Okay. Thank you very much, sir. You could lower your hand. Therefore, the patient is negative for the Phalen's test because there is no tingling sensation, numbness, burning sensation, or pain due to the movement. Now, I'm going to do the Tinel sign. Okay, sir. What I'm going to do is I'm going to palpate or percuss your finger. So I'll just use my other finger as a support and I'll be pushing it. Okay, sir. Observe for movement, shaking, or sudden sharp pain to the fingers of the patient. Is there any pain while I'm doing that? Okay. The other hand, I'll just be positioning myself to the other side. Is there any pain? Okay. So upon doing the Tinel sign, there is no tingling, no shocking sensations experienced by the patient during doing this test. Okay, so sir, I'll just be observing it. Just relax your arms like so in your legs. Okay, there is no shaking upon checking for the flick signal. Okay, so there's no shake or flicks of the hand while resting. Therefore, the patient is, we could say that the patient has no carpal tunnel syndrome because he is negative from the Phalen's, Tinel's, and the flick signal for the hands. Okay, so next, let's move to the fingers. Now, sir, I'd be As I have assessed earlier, the fingers have no swelling, redness, change in color, or nodules noted upon palpation. Now, sir, I'm going to ask you, sir, to spread your fingers apart. Okay, now make a fist. Okay, very good. Now, I would be asking you to bring your fingers down, like so. Here, there we go. To make the wrist straight. Okay, students, when assessing for the fingers, make the wrist straight and fingers down. Okay, fingers straight pointing forward and upward, hyperextending it. Okay, thank you very much. Now, sir, I would ask you, sir, for the thumb movement. Okay, please do like this. Raise your thumb, move it side to side. Okay, move it forward and backward. Okay, now I'm trying to apply pressure. Try to move it up. Try to move it up. Okay, try moving your thumb side to side. Okay, thank you very much. Now, sir, what I want to do is thumb on the side of your fingers. Exclude your thumb, separate, and then your thumb touches the base of your pinky finger or your smallest finger. Okay, and then out, near to the palm. Okay, and then on the side, and then down. Okay, so upon doing those movements, there is normal range of motion upon doing your abduction, adduction, flexion, and hyperextension, plus the movement of your thumb. Okay, so next one, we've already inspected the size and shape of the fingers and the colors. We would be moving on to the hips, sir. So now I'm going to inspect your hips. Okay, so I'll just be checking it. Okay. Thank you very much, sir. Okay, so upon inspection of the hips, the buttocks are equally sized. The iliac crest are symmetric in height. Is there any pain? Upon palpation, there is non-tenderness and there's no crepitus found. Okay, so tip of advice, if ever the patient is suspected or has unrecalled hip surgery, please don't test the range of motion kasi it might cause further damage or harm to the patient. So, I advise you to do ROM or test for range of motion if the physician clears your patient to do so. Okay? So, now again, sir, we would be doing, sir, I would be asking you, sir, to lie on the bed again, sir. We're almost done. We're halfway to the musculoskeletal system. Okay. Okay, sir. So now I'm going to ask you to raise one leg at a time, straight, up and down, straight, up and down. Very good. Now I want you, sir, to flex the knees as far as you can. Okay. Flex. Try to reach your chest. Very good. Also to the other side. Okay, thank you very much. Now what I want you to do, sir, is extend your knees, bowing it away from the center. There we go. And then towards the midline. Straight. Okay. And now I want you, sir, to do is rotate your legs or thigh inward. Okay, and then outward. Okay, thank you. And with a straight line, try rotating it slowly inward. No, slowly inward. Okay, there we go, and outward. And now I'm going to do circular motion. Try circular motion with this foot. Okay, and this foot as well. Okay, thank you very much. Now, last but not the least, try lifting your foot with resistance. Okay, to the other side. Okay, thank you very much. Was there any pain while doing the exercises? Okay, so upon inspection of the hips, upon extension, flexion, abduction, and adduction, rotation and circumduction, plus testing the muscle strength, there is good fluid flow or movement while the patient is doing it. He complains no pain or tenderness upon doing the exercises, and flexion of the joints and the parts of the joints are fluid and without any cracking sound or any pain upon doing the exercises. So I'm going to inspect the knees. The knees are symmetric in shape. Upon palpation, there's no swelling, there's no nodules, there's no evidence of fluid. Okay, try moving it and dangling your legs around. Is there pain on movement? Okay, sir, try moving it. Okay, other side. Okay, sir, thank you very much. Okay, so upon inspection and palpation of the knees, there is no swelling, there is no deformities, it's symmetrical, it's cool, so there's no signs of arthritis, the muscles are firm, and there are no nodules. Okay, if ever that there is swelling present, I've discussed already that you would do the bulge test. Okay, so if ever you're going to do the bulge test, you check your hand. Using your hand, you try to move the fluid towards the center and check if there is change in the shape within the knee. Okay, so that's the bulge test. And then for the ballottement test, what you're going to do with the patient lying down, you put your hand above and try to manipulate the fluid going downwards, and checking if there is fluid shifting or clicking. Okay, so doing those tests would tell you that there is fluid buildup within the knee. Okay, and also if the what they call this, the client is complaining of locking, I've also told the McMurray test, but since the patient is not complaining any pain, I would not be doing the McMurray test. Okay, sir, I want you to stand up again. This is another series of exercises. Okay, so sir, I want you to bend your knee. For example, your patient is an elderly, try supporting him or her while doing these exercises. Okay, sir, on the opposite side, try to bend your knees and try to touch your buttocks with it. Okay, they are just, sir, move forward. Try bending your knees up to your buttocks. Okay, now to the other side. Oh, sorry. Okay, thank you very much. Now, sir, we are trying to do this with resistance. Try raising your knees again. Okay, thank you very much. Try raising the other side. Okay, thank you very much. Okay, try to put your knees forward, sir. Okay, then hyperextend. Thank you very much. Okay, so upon ROM plus strength test, the patient is able to do ROM with 5/5 strength test because he is able to withstand resistance with the movement of that extremity or part. Okay, so now, sir, we're going to do the last step. I would ask you to sit down. This one is inspection and palpation of your ankle and feet. Okay, sir. Now I've already done the walking in the earlier part, so I would not let my patient do that. So the patient is able to support with both feet flat on the floor, with an angular shape on the heel towards the plantar part of the foot. The patient's toes is pointing forward upon assessment. Even now, he is sitting and standing earlier. There's smooth prominences within the foot. Okay. There is no swelling apparent and noted for both of the foot. Okay. So there's no signs of edema as well as checking for the ankle and feet. Okay, so just let me just palpate. Is there any pain, sir? Okay, so upon palpating and checking for the temperature, the patient has no redness, swelling, or pain upon palpation, and the temperature is not that hot, so no signs of arthritis noted. Okay, next one, I would be doing the squeeze test again, sir. And I will be also assessing your joints in the foot. Okay? Okay, sir. So I'll start from the toes, going to your ankle. Is there any pain? Upon pressing or squeezing your foot. Okay. So, for the findings, there is no swelling, no pain. And upon doing the squeeze test, there is no pain as claimed by the patient, and is able to tolerate the squeeze without extreme pain. Okay. So, the next exercise that I want you to do is I want you to do dorsiflexion or pointing your toes upwards. Are you able to do so? Okay. So you want to do it so that the students will see. Okay. So you could use this one, sir, as your basis. Okay, sir. Toes in your neutral position. Okay. Very good. Try to point it upwards. Relax. Okay. Thank you very much. Hold it down and try to point it downwards. Okay. And then kindly, sir, turn your feet outwards, like checking for a bubble gum on your sole. Okay, and try doing the reverse. Okay, so now I want you, sir, to rotate your feet inward and then outward. Okay, so the findings for those movement or test our ROM. Oh, sir, let me test also the strength. Try moving your toes upward and then try moving it downward. Okay, try moving it side to side, inward, outward. Okay, thank you very much. Okay, so upon assessing the ROM and the resistance, so the patient is able to do the dorsiflexion, the plantar flexion, the eversion, the inversion, abduction and abduction without any problems. The patient is able to execute it smoothly. There's no pain upon doing the exercises. Okay, and there is full range of motion even with resistance. That's why I would be giving it the strength of 5/5. Okay, so that ends the assessment for our musculoskeletal system. Our favorite last 3 things to do. So formulate our nursing diagnosis. We formulate and make collaborative problems and collaborate with the other healthcare team members and make necessary referrals. Don't forget to do hand hygiene, assist your patient out if ever he's outpatient, or assist your patient back to a comfortable position. After that, doing that, document in the chart for pertinent or significant findings. So from my patient, Mark, and me, have a nice day, keep safe, and God bless. Bye-bye.